Wonderful. Thank you so much. Um, so, again, thank you all for coming. Let me make this so that I can see your faces, all of your friendly faces. Wonderful. Um, Excellent. So, just to let's see. Yeah, go through a brief agenda for today. Want to be mindful of everyone's time. I know everyone here is very busy and has graciously made time for this meeting, so we're very appreciative. So, what we'd like to do is do some introductions, and because let's see, I think we have enough time to go through some quick introductions. I'll introduce our team here, and then folks can do a quick round robin. Let us know your name, where you're calling in from, and what your clinic or institution is that you're calling in from. We will talk about kind of the background of both this paper and another paper that we're in the process of wrapping up. Actually, we're in the finishing stages of a paper on interprofessional education, and we're planning. We'd like this to be, kind of the next step in that, because we talk about, how do we train our students to both in oral health professions and other health professions? How do we train them to work collaboratively? And then obviously the next step is how do people actually work collaboratively when they're out in practice? So we'll talk about both of those papers. Talk about the process for how the paper I think will come together based on the what we've done with the IPE paper, but we're also open for all suggestions. We would like to leave the meeting with an idea of some volunteers for outlining the paper. That will be the first step. So you can be thinking about that. We're not going to ask people necessarily to, you know, commit their time today necessarily, but hopefully our goal is to give you enough information so that you have an idea of what's involved in that. And then you can either volunteer today, and then we'll also follow up with a survey in the next few days. And so you can have some time to think about your bandwidth and your interests and whether you'd be available to work on that. And then also work on the paper itself and providing some use cases as well, which we'll discuss here in a few minutes. Then we'll talk about next steps and a general timeline, and of course, leave plenty of time for questions afterwards. So I will get started by introducing our team. So my name is Lisa Heaton, for those of you whom I haven't met. I am the science writer for the Analytics and Data Insights team here at CareQuest Institute. And I've been with CareQuest now for a little over 3 years, about 3.5 years. I was originally at the University of Washington School of Dentistry. I'm a clinical psychologist by training. So the idea of interprofessional practice, especially with oral health and behavioral health, is something that's really near and dear to my heart and something that I was involved in quite a bit in my last position. So I'm super excited to be involved with all of you to help tell this story in more detail. Actually, why don't I hand it off to the rest of my team members? I'll hand it to Hannah Chung, if you'd like to do a brief introduction.
Hi everyone, I'm Hannah. I am the health science specialist on the Analytics and Data Insights team. Do a lot of things in my role, project coordinator, survey development, really anything you name it under the sun I help with. And IPE and IPP, I'm so excited and interested to be working with a whole bunch of collaborators. So it's nice to meet you all. I'll pass it to Kelly.
Kelly Schrader. I'm the program evaluation specialist here at CareQuest. I am calling in from Wisconsin, so a little cooler here than Arizona. I am a clinical dental hygienist, as is Hannah. So I want to just shout out that we have experience interprofessional, collaboration firsthand and see what and know what that's like. So with that, I'll hand it off to Becca.
Hey everyone, my name is Rebecca Prassett. I'm the program manager on the Analytics and Data Insights team. It's so great to see so many familiar faces, as well as I'm really excited to get to know some of our new faces here. Eric?
Yeah, hi, Eric Traby, Director of Analytics and Data Insights for CareQuest Institute. It's my great pleasure to work with all of my team on this call and watch them do all the great work that they do and get to support all that. So, yeah, with that, Lisa, I don't know how you want to handle the rest of the intro, so I'll pass
Yeah,
back.
absolutely. So I wasn't sure how many people would be here, but I think we have time for a quick round of introductions. So if you'd like to just say your name, where you're from, and again, what your either clinic or institution is that you're calling in from, and then popcorn it to the next person. So I will start with the first person on my screen, which is Dr. Ramos Gomez.
Yes, hello, good morning, good afternoon. I'm thrilled to be here. I'm Francisco Ramos Gomez. I'm the chair of pediatric dentistry at UCLA and have been working with IPE for many, many years and really collaborating with CareQuest. So very happy to be part of the family. I will popcorn Tamana.
Thank you, Francisco. Tamana Tawari. I'm an associate professor at the University of Colorado, and have been working with CareQuest for a long time, and in IPE and IPP, I think, for the last 15 years or so. And I will popcorn to Michelle.
Hello, my name is Michelle Gross-Panico. I'm calling in today from Chandler, Arizona, Dignity Health, Chandler Regional Medical Center. I used to be a clinical dental hygienist. I still hold my license. Have a lot of experience with interprofessional collaborations, both teaching it in education and also implementing it in the real world, which is always very different. Currently, I'm clinical program research and development with Dignity Health. So I will popcorn to, let's see, let me flip my screen. Chris Brendamule.
I thought that might be coming my way. So, my name is Chris Brendeville. I'm the director of dentistry for Valleywise Health. Valleywise is the safety net healthcare organization for Maricopa County, so the greater Phoenix area. We're a hospital system, behavioral health centers, and about 12 federally qualified health centers. 5 of those with dental clinics. I oversee dental practice for the FQHCs as well as in the hospital system. And I actually have a copy of Michelle's report on integrating the hygienists in the ICU, which actually sits on my desk because we're working on something very similar for our healthcare systems. I think it's just very funny that we're on the call tonight. So I will go down the next name in my list, Anita.
Hello, good morning. I'm Dr. Pedi Reddy. I'm a dentist and I'm an associate professor and the director for the Advanced Dental Therapy Master's Program at Mankato, Minnesota. It's very cold today and very cloudy. So I'm at the university and I have the class starts in an hour. So yeah, it's a good timing. And this is my first time collaborating with CareQuest. I have attended several webinars by them, and we teach a lot of fluoride, SDF, non-invasive things, especially the advanced dental therapy students treating low-income, underserved patients here at schools and outreach clinics. So yeah, I'm looking forward to the collaboration, and I'm really excited to be here, and I'm going to learn quite a lot, I think. Thank you. Oh, I am going to call out, Lubov. I know Dr. Slatcheva. I work at Apple Tree also, so I've seen her webinars and lot of research. So yeah, morning, Dr. Slatcheva.
Hello, thanks so much, Anita. So I'm Lubov Slasheva, the research director at Apple Tree Dental, which is a nonprofit dental organization across Minnesota. And we have a pretty unique care delivery model that we don't have medical folks on staff except our nurse anesthetist, but we do a really great job of reaching out into the community and making partnerships with across disciplines. So I am excited to try to integrate that into some of this white paper work. Glad to be here. I'll call on John Ard.
Thanks, Luav. Hi, I'm John Ahern. I'm the Director of Medical Dental Integration at the Cambridge Health Alliance in Boston, or Cambridge, Massachusetts. I work as a physician primarily. I also have dental training, and I'm a little bit of my time is with the dental department. And I've been working with CareQuest for a few years, and this is my first time working on a white paper with CareQuest, so I'm excited with the opportunity. I'm going to popcorn it to I'm not sure who hasn't gone. Courtney?
Good memory. When it gets to this late in the game, it's kind of a game of memory, isn't it? Who hasn't gone yet? So I'm Courtney Banna, and I'm calling in from Maine. And like many of us here, I also have a background in academia. I was on the faculty at the University of New England for 12 years in the Westbrook College of Health Professions, and also did my undergraduate training in dental hygiene there. And that was 20 something years ago now. And they were one of the first, I think, probably in the country that was really diving a whole, all in on interprofessional education. And so I think I was probably one of the earliest dental hygienists in the country that was sort of trained in that model. And then, of course, brought that forward into my teaching, training dental hygiene students actually in medical facilities. And now I work with MCD Global Health and provide project leadership to projects of the Children's Oral Health Network of Maine, many of which I've been lucky enough to collaborate with CareQuest on. And very happy to say that the vast majority of the projects that I work on are primarily focused around medical dental integration. So this is also my first time collaborating with CareQuest on a white paper, and very excited to be here. And I think my dental hygiene colleague, I'm assuming, I don't know what your name is based on your description there, but RDHAP, I'm assuming you're a dental hygiene colleague, so I'll turn it over to you.
Hi, I'm Rachel Doherty. I'm a dental hygienist in alternative practice here in California. And I started out with CareQuest in the beginning with the grassroots movement into it because I was on a 5-year grant with DentaQuest. And then we had transitioned to CareQuest. And I actually work at a regional center here in California. So we serve people with developmental disabilities, and we have 30,000 clients here. And they were all being put under general anesthesia for all dental care, including just x-rays and exams. So I got a grant to open a dental desensitization clinic. So I work with a board certified behavioral analyst, and we work together doing a clinic where we practice everything that they'll encounter in a dental office. And, of course, starting with just being able to sit in the dental chair to nitrous oxide simulation that we do. So that they're prepared to be able to be seen under safer sedation with dental providers. And I provide training to the dental providers in the area. And anyway, that's just a little bit of what I do. And then who's not gone yet?
Dr. Thanos, we need to hear from him.
Okay.
Hi, everybody. Thanos Zabras. I'm the chair of public health. Hey, Francisco. Nice to see some friends in this meeting. I'm the chair of public health at Tufts. I have oversight of 7 clinics that see individuals with intellectual and developmental disabilities. This is a partnership with the state, and it's a pretty unique model where we try, with funding from CareQuest, we try to have some innovations introduced, and I'll be glad to speak on another setting about that. In my previous role, I was chair of pediatric dentistry, because I'm also a pediatric dentist, in a different institution. And there we had a HRSA grant for about 8 years, where we created a pretty unique clinic, pediatric dental clinic, and we co-located care. We had speech pathologists, registered dietitians, pediatricians, nurses, etc. So we have pretty good experience with the practice of interprofessional care. So I'm very glad to collaborate in this project and looking forward to learn from all of you. And I see, is it Alex that hasn't introduced himself yet? Let me see. Alex Barrera?
Yes, here I am. Sorry, I was having some issues. Hi, everyone. Good morning or good afternoon, depending where you're at. My name is Dr. Alex Barrera. I'm the Director of Dental Services at an FQHC. We are Avenue 360 in Houston, Texas. And so we see a big mix of different patient populations here at our clinic. I've worked with CareQuest before. I've done some presentations. I specialize on LGBTQ oral health and educating dental professionals on how to better treat queer and trans patients. So CareQuest has been excellent in helping me with my passion project. And we've done some presentations together. So I'm happy to be here and collaborate again. A big part of my role here as the dental director is not only overseeing the dental practice here, but to also see how we can integrate our service with our other dental services that we offer at our FQHC. A project that we have currently started in November and have been implementing is integrating our behavioral health and mental health services with our dental practice. So when we have patients come in for either their new patient or recall exams, we survey patients on their mental health as well using the PHQ-9 screening form. Depending on what their score is, we then either educate the patient of our services here, may refer patients to a mental health or behavioral health specialist at our clinic. And if there's any sort of severe signs of severe anxiety or depression or suicidal ideation, we submit an emergency referral or even have a physician or a psychiatrist come down to the dental chair with us. So really excited to be here and continue to collaborate with everyone. And I'm not sure, I stepped out for a little bit, so I'm not sure who else is missing.
No, Dr. Burrow, you're perfect. I think you were the last person to go. So thank you all so much for sharing your experiences. We have obviously an enormous amount of experience just here in this room. And so we're really excited to have the opportunity to work with each and every one of you. So I will move on to talk a little bit about the background of this project. So back in the summer, we put out a message on various listservs to talk about writing a white paper on interprofessional education. And we had a great turnout. And some of you were on that call. Francisco, I think you were on that call. And we had a really great discussion, Tamana. And we had a really great discussion. And what we decided is we were originally thinking, well, we'll have IPE and we'll talk about IPP as a piece of that. And it quickly became very obvious that no, these needed to be two separate papers. And so we said, okay, we'll start with the IPE paper, and then we will turn our attention to the IPP paper, because we're talking about in the IPE paper, how do we incorporate oral health into interprofessional education, and how do we make sure that programs have a seat at the table? And then we thought, the really kind of the proof in the pudding is, how does this translate into when people are actually in practice, right? Because students are going to do the activities that they're required to do when they're in school, but then how do they translate that once they're out and providing patient care? So we are really excited to be launching this IPP paper. So to give you a little bit of structure of the IPE paper, for those who aren't familiar, we've got two sections to this paper. What we're referring to is the background, and that has things like history of IPE, accreditation requirements from IPEC and CODA. How is IPE implemented? What are some barriers and challenges, and some recommendations? And that's a very, very brief overview of that background. And one of the things that I think is particularly useful for this paper, that I hope will be useful, is that we have 19 educational programs that are writing up. They've contributed brief descriptions of the IPE activities that they are engaged in at their institution. Some of them are shorter, some of them are more robust. And we were talking about it in a meeting this morning. We were thinking of these use cases as sort of in the end goal, it's kind of a buffet table, because ultimately what we want is for for both papers is for people who are interested in engaging specifically for this paper in interprofessional practice. Let's put out there what people are currently doing, right? And kind of put that out as a buffet table. So people can look at that and say, there is some amazing stuff going on at these different places. I would like to, this in particular is really interesting to me. We can implement this in our program. And so we can take that. This maybe wouldn't fit in with our program, so we're going to leave that for right now. But we have those use cases out there so that people can see what is going on, because I think a lot of times, especially in oral health, we tend to be somewhat siloed. And so we know all the great stuff that we're doing, but we don't necessarily know all the great stuff that other people are doing, especially outside of our immediate region. So for the IPE program, we have this background, we have the use cases. And so the overall goal is to provide a resource for, in that case, educational programs that are looking to either develop or expand their own IPE activities. And that IPE paper we're aiming to publish on the CareQuest Institute's resource library, and Hannah's going to pop a link to that in the chat for those of you who might not be familiar with it. We're looking for April 2025. We're hoping to launch that before the NOHC meeting, because we're going to have a few roundtables that talk about that. And we think of this IPP paper as being very similar. We could give a background and a description of IPP and how it's put into practice, some barriers and challenges, and then also have these use cases. So hopefully some of you will be, just in the brief descriptions that you've been giving of the programs that you're involved in, it would be amazing for you to write these up, and we will be happy to share in the next week or so a draft of that IPE paper. I'm going to have to try not to keep switching those back and forth. The draft of the IPE paper, so that you can see how that looks and you can see what the use cases are, and see if that's something that you're interested in contributing. So that is some background on the IPE paper. So what we were thinking of, as I mentioned before, for this IPP paper is somewhat to mirror that IPE paper. We see them as being very complementary to each other. So have a general structure of the background and use cases. And then as far as the background is concerned, and Kelly will speak more to this in a few minutes here, but some brief examples of the oral systemic connection. For example, oral health and diabetes. It's linked with pregnancy and dementia, that sort of thing, to really lay the groundwork as to why IP interprofessional practice is important. Possibly a discussion of some history, the importance of interprofessional practice and teamwork, maybe some examples from the literature. And I'm saying that these are potential because we're going to ask folks to who might be interested in outlining this paper. And so it will ultimately be up to you as to what goes in that section. But these are some ideas based on the IPE paper, but things that we thought could be helpful. Barriers and challenges, as well as opportunities. I'm sure this group can talk at great length about the barriers and challenges, because if doing IPP were really easy, everybody would be doing it. But we're hoping that this is a resource so that more people can do that, and more people can say, oh, so these are some barriers, and I see that those are barriers in my situation, but here are some opportunities as well, and here are some ways to help overcome those barriers. And also some recommendations that you could make for programs that are either looking to start or to expand. So let me just see. Yes, let me talk about the process, and then I'll pause for questions. So generally speaking, this is the process that we're following for the IPE program. So today we'll start to identify a group who's interested in working on outlining the paper. Again, we'll start doing that today, and then we'll also send a follow-up survey to get more, because obviously we're not going to just rely on the people who are here, because I know we've all been in those meetings where we look around and we're like, okay, I know there are a lot of other people who could be at this meeting. I'm going to be the one who's volunteered for this because I'm the one who showed up. So just want you to know that we are going to spread out the opportunity, and it's not just going to be for folks who are on this call, but obviously we would love to have your participation in that, and we'll also extend it out to other folks who weren't able to be here today. We'll survey the group to find out not only who's interested in doing working on the outline, but who's interested in working on other sections of the paper once the outline is established, and who's interested in contributing a use case. So you can be thinking about your own program. Again, there's some amazing programs that were just described in the first few minutes here. So then once the outline is drafted, and we'll talk about timelines here in a few minutes, we'll circulate the background to or the outline to this group, and then solicit volunteers for, if there's a section that you're really passionate about and you say, I would love to help work on that section, we would love to know that. So we will do that. Then you all, what we've been doing in the IPE group is that we've had groups of collaborators, 3 to 6 people working on a section. So each group has been working independently on that. And so all of the groups will send in their contributions and use cases. On our end, we will consolidate all of that information. So for example, when you're writing up the background, you don't have to worry about citations in a proper format. We will worry about all of that. We have a wonderful, amazing copy editor that we work with who will help with that. We'll do some light editing for flow and to make sure that everything's in one voice. And then we'll circulate that first draft back to everybody who's involved for anything that might be missing, anything that you think you'd want to change at all. Then we'll take those edits back from this entire group. Again, do any editing that needs to be. And then on our end, we have an amazing proofreading service that we work with, and an amazing external designer who takes all of our, as the science writer, I have a lot of Word documents that I send to her, and she makes them look really, really pretty. So I can vouch for her skills in making this look incredibly polished. So, and then, as I mentioned before, the goal is for this to be published on the CareQuest Institute resource library. And then, of course, you can share that with all of your social media accounts and all of that. And we'll do a marketing push on our end as well. So I just threw a lot of information at you. So I want to pause here to see if there are any questions.
I do have a question.
Yes, please.
Yeah.
Yes.
So, how do you envision the case writing? So we can have a description of, the IPP, all of that stuff. But do we include barriers and opportunities and problems in each case, or do we write it at the very end?
Yeah, that's a great question. Thank you for that. So for the use cases in the IPE paper, we gave a general set of questions for folks to address, and one of them was the barriers and challenges, because we know that everybody's dealing with different issues in terms of space, in terms of what other health professions they have access to, in terms of funding, in terms of provider willingness, that sort of thing. So we would love to we would love for the use cases to include barriers and challenges, and ideally how you were able to overcome those challenges or work around them or something like that. Does that answer your question?
Yeah, that's great. Thank you.
Wonderful. Thank you for that. Other questions?
Also, maybe in addition to that, one of the biggest challenges we have is sustainable model.
Yes.
Reimbursement finances for these programs. So I think that's a very unique, very idiosyncratic to each site. So I'm not sure we're going to be having independent or each case study addressing those. Perhaps it would be ideal to maybe have an outline on the description of the cases, so they could be going more nicely, that we can all sort of have the same kind of template that we fill out if we're going to be just some idea on that.
Absolutely. Yeah. Thank you for that, Francisco. I think sustainability is going to be a really key piece to that, because that's the statistics, I was going to say, 90% of it, but I would think launching it anyway. I'm not going to try to break down the effort, but sustainability is such a huge piece of that because it's wonderful to have this program that's launched and is doing amazing work. But if there's not the funding or the other forms of support to keep it going, that's really challenging. So I think so what we did with the IPE paper is we did have sort of some bullet points. Here are some things we would like for you to include if possible, and then and that sustainability I think would be a really important piece. And then folks are always welcome to include more information in their use case. But one of the really nice things about doing this as a self-published through CareQuest is that we don't have the same, for example, word limits or page limits that we would have for a journal. So we can, in the IPP paper or IPE papers, people were saying, well, I don't know that I can cut it to, 1,500 words. I'm like, don't cut it to 1,500 words. It's fine because there are some people who wrote less, some people who wrote more. It all kind of balances out. So. Great. Other questions or thoughts so far? Okay, hearing none, and we'll also leave some time at the end if there are other questions that come up.
I'm sorry, I do have one question.
Oh, please, yes, Michelle.
Timeline. I was curious about timeline, or are you gonna? Oh,
yes, you were ahead of me, Michelle. I appreciate that's a beautiful
I'm your
segue.
There you go.
I love it. Thank you so much. So the general timeline that we're looking at is, this month in February, we're obviously having this kickoff meeting, assign a group to outline and start to draft or outline the paper, and then identify people who are going to write up use cases, and we'll cast a pretty wide net there as well. So for example, if you have folks that you know of who maybe aren't on this call or somehow did not end up on the invitation that you think would be great to contribute a use case, please forward their information to us. We would love to connect with them. February and April, we're going to have set aside for obviously outlining and drafting the paper and handing back and forth the different drafts. We would like to have that kind of finalist draft where we're consolidating all of the final edits by about May, and then put through our copy editing and proofing and design process in early summer, and ideally having this published in June or July of this year. So it's an ambitious timeline. But I think it's, with, especially if we're looking at just the people on this call, you're thinking that's not a lot of people on this call, but there were other people who aren't able to make it. And, as we expand this a little bit, I think many hands will make light work. So excellent. Questions on the timeline?
I don't have a question, but your February to April with
AADOCR and NOHC, and ADIA.
So that I just want to remind you that the big three spring conferences are going to be during that time.
I appreciate that.
Can be good because we can actually have an in-person meeting at one of those meetings if many people are there. And also it kind of reduces the capacity of people to write when they're constantly on the move.
That's a really great point, Tamana, and I appreciate you calling that out. And there's some playing time for some folks that yes, and at the same time, that is a very important piece, is that for folks who are attending either AADOCR, ADIA, NOHC, or any other conferences during that time, that could limit the time as well. So there is some flexibility in that. And so if, as we're going along, folks are saying, yeah, I really just have not had the time to do this, we can make some adjustments there. This is our our starting plan. So, but there is some flexibility in there. So thank you for calling that out, Tamana. Other thoughts, comments? Yes, Francisco.
Yes, Lisa, I just was thinking about maybe I'm not really sure about exactly the how the other paper was really outlined, but did you guys discuss about having maybe sort of like a timeline of a specific age range, sort of following pregnancy, 0 to 5 year old. Well, so we could maybe discuss cases based on age in some sort of like more of a life course pathway which might be a very interesting way to see them. I'm not sure if there's any discussion of that. Is part of a discussion for us to talk
Yeah,
about.
that is an excellent point, Francisco. And so, so can I take that as you're volunteering to help outline the paper?
Well, I'm not sure about
Not to
that,
put you on the
but
spot. Okay.
life course would be a very interesting way because I'm not sure how we all overlap or not, but it'll be very
Right.
nice to do a description of case studies or models that are effective that can really
Mhm.
address the needs of life course. So I'm not sure the
Yes.
IP paper was outlined in that way, but maybe you can tell
Yeah.
us how that was outlined and if they follow any sort of pattern of age-specific patient-centered approaches.
Yeah, that's a great question, Francisco. And I apologize. I did not mean to put you on the, we're friends, so I felt I could put you on the on the spot there for a moment. Um, and
Only if Tamana and Stavros take the outline with me, I'll take it. If not, forget about it.
okay, so I'll put you all down as volunteering. That's great because you can volunteer yourself or you can volunteer other people too. We'll take that too. Yeah. Oh, goodness. But to your point, Francisco, because we started that IPE paper with more of a sense of um, sort of how we thought of that paper, and then the IPP paper sort of came after that. We started out on the CareQuest side as doing a general outline in terms of what we thought could be helpful in a paper like that, and it has expanded somewhat as our subject matter experts have been drafting that and saying, oh, we think this needs to be addressed, and this should really be part of that. And so because we followed a slightly different process for this paper, we don't have an outline for it yet, which is why we'd be looking for volunteers to include that. So your suggestion about the life course, I think, is a really good one, and I could see that maybe fitting in a few different ways. And Kelly, you could maybe I'm sure you're taking notes as we're talking, and Kelly will talk about the outline here in a moment. But ideas of how we could do that. And so I could see that maybe being part of the history or maybe being part of the recommendations section where you're saying, okay, if you're thinking about certain periods of the lifespan, it's important for this IPP to be able to span across the lifespan. And Tamana and I and Eric wrote a paper, on that specifically about medical dental integration and behavioral integration across the lifespan. So I think that's particularly important. So thank you for that.
And because I'm looking
Yes.
for opportunities to work with Francisco,
Yes.
I would jump on this opportunity to outline with him.
Wonderful. I think, Francisco, you've just been volunteered by two people now. So I think that means
And I'm volunteering Tamana. Tamana is my partner in crime, so if Tamana is not with me, I'm not gonna do it.
Oh, I will do whatever I've been told by Francisco.
it's probably just a safe bet is, if Francisco says it,
Here's
Stavros
her
who
two
says it.
times.
Yeah,
Lisa,
it's a good.
you'll be the boss, Lisa. We need a policewoman behind us with
Oh
a
my goodness. Well, you know me, Francisco. I'm the
Oh,
tough
she's
one.
a good cop. You need a
Yeah.
bad cop like me.
That is true. I am more of the good cop. It
Yeah.
So
is
who wants to
true.
volunteer for being the bad cop? We need
I'll
a
play
bad
bad
cop.
cop if we need it, but I don't think this group will need bad cops.
Yeah.
I don't think so, but we'll keep Eric on the back burner as bad cop if need be. Excellent, excellent. I love it. I love this conversation. I could talk with this group forever, but I also want to be mindful of time. So I'm going to hand it over to Kelly to talk a little bit about the outline process and the section and drafting the outline. So Kelly?
Yeah, so I think you guys have already covered, like, I feel like it's written. We've already done it. So I have been taking notes, Francisco. I did include sustainability and the life course pathway into kind of our list of suggestions. As with any good paper, we want to make sure that we have a well fleshed out background about what is our topic and why is it important. So that's to start with is just having reminding our readers about what the oral systemic health connection is and, what it means, how it works. It's amazing how many medical providers just kind of forget that there's actually like a nerve and blood supply in a tooth, all the lymph nodes in the mouth. So just having that reminder to start with of what we're talking about with oral systemic health. And then, why are IPP programs important and what is the history of it? How did we really kind of, we know how oral and systemic health were separated, but how did we start bringing them back together? What are some examples of some early programs? And then, of course, we want to talk about the barriers and challenges, along with opportunities and protective factors. So some of the barriers and challenges were brought up. Additional ones that we have been talking about, in addition to like electronic health records and sharing patient information, are things like coding, for the work that you did and actually getting reimbursed. So that's that, funding and sustainability all kind of fits into that. Do we want to talk about alternative payment methods or incentives for providing quality care and whole person care? And then I love that life course pathway and figuring out how that all fits in with that. So we will have a separate group for whoever is interested. If you have ideas, but you don't necessarily want to be part of the outline group, feel free to share those. So anybody who has been volunteered today, anybody who wants to volunteer today, fantastic. Otherwise, like Lisa said, we'll be sending out a survey to see what where your interest is with creating that initial outline. So anybody have any questions or comments?
So you or someone is gonna sort of take the lead of helping us get the meetings together, or how is
Yes.
that gonna work? Sort of in
Yes.
the way of getting our ideas put together or summarizing for us, or
Yeah, so first we'll get a list of who actually wants to volunteer, and then I imagine we'll send out a survey monkey to figure out what time works best to meet to create the outline, and then we'll share it with the bigger group.
so Kelly, you'll be our point of reference for the outline.
Yes.
Okay.
Excellent.
Mm.
Thank you, Kelly. Yes, Kelly's going to be the point person in helping to draft the outline. And then, as you mentioned, once we have the outline, we'll share that with this larger group. And then, as you look and say, oh, this section is something that I'm really passionate about, really excited about. If something like that strikes you and you say, I want to help write about that section, perfect. That's, once we have the outline. So if you're interested in volunteering, feel free to drop your name in the chat. But again, we'll also be following up with a survey. So wonderful. Excellent. Okay, so next steps, because everybody wants to know, as we've been talking about, when are we thinking about all this? We've gone through a general timeline. What we'd like to aim for is to have an outline drafted by the end of this month. So by Wednesday, aiming for Wednesday, February 26th, and then we can circulate that and folks can start volunteering for different sections. So if that helps go into your calculation in terms of whether you'd like to help with the outline, fantastic. I always like to know what the deadline is before I, volunteer for something. Like, okay, is this due tomorrow or do I have, a while to work on this? We're also going to send out invitations for completely optional office hours. We have 2 set up right now, and we can always add more if that's helpful. The first one is going to be Monday, February 24th, which is the Monday before the outline is due, at 12 p.m. Eastern, 9 a.m. Pacific. And then we're going to have a second one that, again, we'll send out these invitations for Monday, March 17th, which we see as, people will be kind of in the writing process at that point at 3 p.m. Eastern and 12 p.m. Pacific. Now, these are 100% optional. If you have questions and you can make it, feel free to drop in anytime. They usually go for about an hour. But and as you'll see on there, if those times don't work for you or you'd rather meet individually, please feel free to reach out to me or Kelly or Hannah, and we can set up a time to meet individually to talk about that. And again, we'll send out invites for both the survey and a recording of today's meeting within the next several days. So Francisco, you came off of mute. Did you?
No, just to know if there's any options besides Monday. Mondays are really is my clinical day, so I'm not sure if there
Okay.
are other dates and it's not a Monday that can be alternative, or we can do.
Sure, absolutely. Yeah.
So,
You know what we can do, Francisco, and I'll make a note to myself is in the survey, we'll also ask, are there better days for folks to meet? And if we find that, most people can, a lot of people can meet on a Friday, then we can set up an office hours on a Friday. So
thank you.
yeah, thank you for calling that out. Perfect. Wonderful. Okay. All right. I'm mindful of time, but want to see if there are any remaining questions while we're all here together. And of course, our emails are all here. So if you have any, if you sign off the call and you're like, oh, that's right, I had a question about that, or you start pondering it a little bit more and you have more questions and you want to reach out and ask us any questions, please feel free to do that. But wanted to leave space for any other comments or questions.
So just to clarify for the outline, and I promise I did not plan to volunteer at all. But since we're on the spot with Tamana and Stavros, maybe we can work together in just a draft of an outline. And if anyone else in the team or in the group today wants to join us, we can then have some sort of discussion on that. Just a very, very, very rough draft of what we can think it look like. And we work with Kelly on that. But if anyone else would like to join, please feel free to let us know. Does
I
that
see Dr. Pederetti volunteered as well. And Michelle as well. Excellent.
Okay, Kelly, if you just send us a list of their emails of people so we can have like a little small group to discuss. And I'll try to work with Tamana and Stavros just in an outline. The rest of the group, we can work together, send it out to you guys for your feedback. How does that sound?
Okay.
Yes.
Great. And Rachel, I see you've dropped your email in there. Are you also interested in being part of the outline? Perfect. Wonderful. Thank you. So Kelly, you got Rachel Doherty? Wonderful.
So can you send us a list of who we are so we can take it from there? It would be very helpful.
Yes, I think we can send out an email to everyone who volunteered here. And what we'll also do is we'll, just to give folks an opportunity who weren't on the call today, we'll also forward out the email just because we want folks to be able to participate as well. I am so excited about your excitement, Francisco, and you're ready to go. And so if you and
Well, then
Tamana,
pay back, Liz. I'm gonna ask you for a favor. So
I have no doubt, Francisco,
because
much
we're in
like
the
Tamana
middle.
said, if
No.
Francisco asks,
Thank you so much.
You just do it.
That's
It.
right.
Thank you.
Exactly.
Thank you. I'm very blessed to have you guys in my life. Thanks so much.
Oh my goodness, we feel the same. So maybe what we could do is if the group who has volunteered today, if you're just excited to get started and, or for time reasons, you're like, I'd like to just kind of get this done. What we can do is we can also, again, we'll send out the survey and we'll ask if there are other people who are interested in that. And then perhaps if you all are like, let's just do this now, you come up with an outline and then we could like circulate a second group. If there's a whole group of people who say, absolutely, I want to be part, because some people might say, I really want to make sure that, X gets into the outline. So does that sound like a reasonable?
Yes, I think that just to have like a small group to work on just a rough draft of the outline,
Sure.
then we can play it all and people can add, take out, say,
Sure.
then they can take the piece of the outline they want to take part of. That would be best.
Perfect. That sounds great.
Very good. Well, thank you,
Excellent.
Lisa. Thank you, Eric. Thank you to all the team and to all of you for this great, great project. We're excited about it.
Thank you so much, Francisco, and thank you all for taking time out of your very busy days and for being excited in this project. We are very excited to work with all of you. And yeah, again, please feel free to reach out if you have any questions, comments, thoughts. You have our emails, and please be on the lookout for a follow-up email with the recording from the survey, and I say there was another thing.
Kelly can
recording.
send us a
Yeah.
list of emails of the key people for the outline. Would be great.
Yes, Kelly will follow up with an email for the folks who volunteered to draft the outline.
Thank you so much.
Wonderful. Excellent. With that, I will give you 7 minutes of your day back. Thank you all so much. Talk to you soon. Bye-bye.